Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. According to the Centers for Disease Control and Prevention, the CDC, over 75% of the 2.8 million traumatic brain injuries, which are called TBIs, occurring each year are concussions, making it the most commonly diagnosed type of TBI, traumatic brain injury. Millions more people who suffer from concussions, however, go undiagnosed, dismissing their injury as just a bump on their heads. The effects of concussion can be long-standing and serious, and there's considerable misinformation about this injury. During today's show, we will learn more about the steps that should be followed after a concussion or suspected concussion is sustained, anticipated recovery times, and expectations during each phase of recovery. We are pleased to welcome Marla Johnson, Director of Off-Site Physical Therapy at RWJUH Somerset, and Jeffrey Stankus, Physical Therapist at RWJ Sports Physical Therapy at Princeton. Welcome to the show. Thank you both for being here. First, for the studio audience, can you both introduce yourselves and let us know a little bit about your background? We'll start with Marla.
Sure, and thanks for having us here. My name is Marla Johnson, and I am the Administrative Director for the outpatient physical therapy sites for Robert Wood Johnson University Hospital. And I've been here with the hospital for about 10 years now.
And Jeff?
Yes, I'm a physical therapist. I am based out of the Princeton office. I've been with, I believe, Robert Wood Johnson now for 8 years. I've done some grant work related to concussions in the past. And that's how I got involved with this program. And again, thank you for having us today.
Thank you very much for both of you being here. We've heard in the news recently a lot about concussions. There was a movie that recently about it. And of course, everyone who watches football on either Saturday or Sunday sees what's happening. So can you tell us actually the definition of what is a concussion?
A concussion is basically a form of a mild brain injury. It goes a whole spectrum of how involved it can wind up being. But I sometimes use the analogy of if you've seen a ball, baseball, golf ball, tennis ball get hit in slow motion, you see that ball kind of deform. That's basically what happens with your brain inside your skull, and that point when it bends causes cells to break and get damaged, and that's what causes the symptoms that we refer to as a concussion.
And those symptoms of a concussion are?
It can be headaches, it can be dizziness, double vision, loss of consciousness, loss of sleep cycle, sleeping more, sleeping less, lack of concentration. The symptoms are pretty robust because, everyone's brain is different. Everyone builds pathways a little different. So we roughly know what parts of the brains are responsible for certain things, but no one's brain has the exact same nerves and neurons in the same order. So that's why the symptoms can vary quite a bit.
So basically we have this soft tissue brain inside of a hard skull, and it either gets hit or it moves fast and the brain sort of hits the hard skull, and that's sort of what a concussion is.
That's the mechanism that kind of causes the concussion, yes. Your brain, there's a gap between your brain and the skull. As we are younger, that gap is a little smaller. As we age, unfortunately, our brains do shrink a little bit, so that space gets a little bit larger. So that's why you tend to see concussions more in younger people than older people. It's not to say an older individual can't sustain a concussion. But the other caveat to that too is when you're an adolescent, your brain is going through that change into your adult brain. So it's using a lot more energy and it has a lot more processes going on. So that also makes them a little bit more susceptible, even if they didn't have a little less space than an adult brain. It's just going through a real big metabolic process. So that makes it vulnerable.
So who is at most risk of having a concussion?
Usually it's the adolescents are at the most risk. Couple factors go into that. Like I was just talking about, when you're an adolescent, your brain is going through that change, turning into an adult brain. But they also be the ones that tend to take a little bit more risk, right? They put themselves in situations where they can, they don't know better. They can, hit their head hard, or they think it's cool to not wear a helmet or wear a seatbelt. As we tend to age, we tend to take less and less risk.
And steps that everyone should take to prevent concussions?
Everyone wants that magic solution. They've tried to research different types of helmets, things like that. Really what it boils down to is making sure that, yeah, you are wearing a helmet if your sport or activity will let you wear a helmet, wearing a seatbelt in a car. Some of the more anecdotal things that I believe in is teaching good tackling technique, good form in sports. Asking a kid if they're going to tackle, what's the last thing they saw before they tackle. They should see what they're tackling. They shouldn't see the ground. Teaching good sportsmanship so people aren't taking dirty hits. They're not trying to shove someone in the back. Emphasizing those elements really are the best ways to decrease the risk of a concussion. Other things you can wind up doing is making sure that someone has full cervical range of motion in their neck. That's a big part that a lot of athletic trainers, doctors miss in the screening process for preseason. It's something that's become a lot more common to do now, but not everyone is doing it. Obviously, if your neck has full range of motion, there's a better chance that you can decelerate your skull before your brain makes impact with it.
So preventative measures are going to include, again, the helmets, like you said, and of course making sure that the coaches actually enforce that they do wear the helmets. Unfortunately, in some sports like soccer, they don't wear helmets and they're constantly heading things. So that's probably a way to increase concussions in people who are playing soccer.
Absolutely. There's something called subconcussive forces. So soccer is a really big, good example of that, where you have these repetitive subconcussive forces, and it's a cumulative effect. Like you might have small impacts repeatedly, and you can wind up causing the same mild brain damage that somebody tackling wrong could do. So you can go from just one instance in football to a half a dozen in soccer, and you can have the exact same result on the brain tissue.
Making sure that our kids put their helmets on when they go bicycling, but also the same thing when they are either skateboarding or doing any other type of activity where there's a potential for fall.
Yes, skiing, anything that you can put a helmet on. It's going to just help lessen the impact. Unfortunately, there's no way for us to strap the brain down inside the skull. So it's really just about creating a way to decelerate that impact before you come to an abrupt stop in the skull, and the brain kind of smashes into the side of the skull.
Which again goes back to what you said about coaching, the fact that you don't want to, in football, you don't want to hit someone with the crown of the helmet. You want to basically tackle it. It's the proper way of tackling someone in football. It's the proper way to, again, bicycle. It's the proper way to do things in the sporting activities.
Mm-hmm.
And again, as you had said, in the adolescents, they're doing all of this. They're at a higher risk, and if we don't teach them correctly, if the coaching isn't correct, that really increases the risk of a possible concussion.
Absolutely. And I think there's been a big push recently in a lot of sports to this term called load management. You don't have to have kids in football tackling every practice. You don't have to have kids in soccer taking headers every practice. That's one way that for coaches to kind of help manage the subconcussive loads or even the risk of a concussion in sport.
And so a kid or an adult is in a sport and they look like they may have sustained a concussion. What should be done? What are the steps that should be done?
Ideally, they should stop and be removed from the sport and get screened. There's a few different ways you can wind up having that done. The gold standard would be like a functional MRI to see if there's bleeding or any kind of that diffuse swelling in the brain. There are what we call clinical tests that we can wind up doing where based on the way your eyes are tracking, how you can handle cognitive load, I can take you through some tests for positioning your head and neck. And depending on how you respond to that, I get a good sense of what's involved in your brain or what parts of the area might be damaged in the brain. And if you have enough of those signs showing up, then we're going to confirm that you have a concussion. You know as well as I do in the medical field, there's a big push towards what's called clinical prediction rules. Cluster of tests, when they're together, have a really high sensitivity and specificity to rule something in or rule something out. And that's what we have in our toolbox. We have a cluster of tests that we can wind up running. And if you're positive or you fail on basically, we confirmed you have a concussion, and it has a high correlation to if you were to get that really expensive functional MRI, it would show that you have a concussion too. Whereas if you were negative on that cluster, you would get the functional MRI and you would be negative for that brain damage.
Which is what we see now sometimes in sports. We sometimes see when the football player is taken off the field and he goes, as the announcers say, through the concussion protocol.
Yes. In the last couple of years, there's been a big switch from having just baseline testing to having actual clinical testing that you can do real quickly. Because athletes, professional football players, high school players realize that if they tank their baseline testing and do like the impact testing is used to be a really good, reliable tool, but athletes started tanking their baseline. So then when they got a concussion and they got tested, they were testing at baseline and they say, all right, you can go back on the field and play.
And the common signs and symptoms of concussions?
It could be that, they seem dazed, out of place if they're on the field. They might be a little sluggish. You might see involuntary muscle twitchings if they're on the field. It could be headaches, double vision, nausea, dizziness, trouble with balance, ringing in the ears. Later in the day, they might have trouble concentrating. They might have trouble sleeping. They might be sleeping too much, loss of appetite. Again, it's a pretty large list, and we put together a handout and we have that information available online for anyone to kind of reference.
And the dangers of getting repeated concussions for the patients?
They can be life-threatening. There's something what's called second impact syndrome. So if your brain doesn't fully heal from the first concussion, you can wind up getting additional swelling pretty rapidly. So basically what happens is deep in that brain, you might have some diffuse axon swelling. And what basically happens is you present fairly good, you go back out, you get a second concussion. Well, now that original swelling is still bleeding, it increases rapidly and a new area increases. And the skull is a limited space. So when that brain swells and starts pressing against the skull, it turns into a life-threatening condition. And unfortunately, second impact syndrome, most people don't make it. And if they do survive, they have lifelong brain damage, and they're definitely not the same person they were before.
Sad. Now, tell us a little bit about the concussion care program at RWJUH Somerset, and maybe Marla can tell us a little bit about also.
Yes. So basically in the last 10 years or so, there's been a big switch in how you manage concussion. It used to be this passive process that you would wait a few weeks and see if it resolved. But then the research came out, and at the International Consensus Conference on Concussion in Sport more recently, they acknowledged that actually active recovery is better. So active recovery really promotes increasing blood flow in a certain amount of range and a heart rate, where we're increasing blood flow to the brain to help it heal, because it is an injury, and blood flow is how you wind up recovering. But we don't want to make sure the heart rate is in a certain range. We don't want it too high, because obviously if it gets too high, then you're shunting blood from the brain to go to the muscles to keep doing the activity. So we started to put together this program that we call the Concussion Care Program, which is really focusing on the early phase of concussion care. where we want people to come in ideally within the first 72 hours of a concussion or suspected concussion. Somebody might not have a lot of symptoms, but we can run them through that cluster of clinical tests, and we can either roll in or roll out with a pretty high degree if they sustained a concussion. If they're mild, what we'll wind up doing is we'll develop one of those active recovery ranges for them, and we'll say, this is what we want your heart rate to be in, this is how we're going to help promote your recovery. And then we'll track them for a couple of weeks. We'll have them come back in. We'll run them through all the tests again, make sure it's clear. And then if their heart rate responds well, we might up it or we might discharge them saying, you know, they've fully recovered. The advantage of it, though, is we can get people into the clinic and we get an hour with each person one-on-one. So it really lets us emphasize the education component that doctors in the ER, urgent care, or pediatricians might not be able to have. And also it lets us make really specific school accommodations if someone's going to go back to school. Again, the research shows that we want to get them into school and start having that cognitive load as soon as is possible. So these tests really let us make really specific accommodations. Again, that it'd be hard for ER doctors, urgent care doctors, or even your PCP to do without some additional testing. And that's really the emphasis of the concussion care program, is it's that first early couple of weeks where we might not ever see them until it winds up being a problem later. And why that's so important is because as soon as you sustain that injury, those brain cells are damaged. So what used to go from point A to point B no longer exists, and your brain is trying to figure out a new way to get from A to B. And with our program, we can wind up trying to facilitate, maybe it's A to C to B, which is the quickest way, versus something might go A all the way through the alphabet to C, because once that pathway is formed, that's the pathway that person's going to wind up using the rest of their life. So our program really can help identify those people in those first 2 weeks and help them overcome some lingering symptoms. Where in the past, if we got them after that 2-week window, we could start seeing that they have a lot of lingering symptoms, and they're going to actually need concussion therapy, where they're coming in pretty regular to address some of those cognitive issues, some of those vestibular issues, vision problems, balance problems. So that's the difference between the concussion care program and just concussion therapy.
Marla, do you have something to add about this?
Sure. And yes, and Jeff's exactly right. So we have several clinicians who've been treating concussions sort of traditionally as we know it as the concussion therapy, right? Like Jeff said, usually a few weeks after. That's typically when our therapists get the phone call from an athlete. They need some therapy. They're still having symptoms. Well, we're already behind the 8 ball because now it's been 2, 3, 4 weeks. So what we found is there was definitely a need, especially in this central Jersey area, for that immediate care in between. We know that if an athlete gets hurt at their soccer game on a Friday night and they either end up in the emergency department or an urgent care, it's going to be, they hit their head. And then what is the education they're getting? What do they do next? Parents don't know. The education is super important. And the doctors don't have time. The nurses, doctors, it's emergency care. They don't have time to really go through all of those things. Plus the work starts when you get home, and now it's 2 days later and you're not feeling well. Right. So we said, you know what, we need to design something. If we can help get to that patient first, right after they sustain it, whether it's suspected or confirmed, call our office. We actually have 5 different offices, including the main hospital site. We can get you in within 72 hours, almost, within some flexibility. We'll get you in, we'll run you through all those tests that Jeff spoke about. We'll do the education with the parents, with the student. We can give you, a log tracker. So if they are going to school or when things are happening, they can write it down. And then we can be that person that then guides that care, gets back to the physician. This is what we found. This is what's going on. So what we find is that 2 weeks in between, most of the time they might be better after that. There might not be any more symptoms. They come back, everything's great, they're good to go, and we're done. And it's really helped the families because they had quick access to care. They knew what to do. They knew the signs to call their physician if something was really going wrong, and they also knew what to do to help lessen the effects of the concussion and get better faster.
Exactly.
And we can handle all of that. So we have some great relationships, and that's what we really thought would be a great help, and that's where this idea came from. So Jeff's worked really hard on it, and we think it's a really great program, and we're already seeing some results.
Well, it's actually terrific because I'm used to an athlete comes in and then to try to get them to the neurologist and to this, it's 2, 3, 4 weeks and they're out of school. They're always feeling dizzy. Their memory is off. Here it's 72 hours and I've got active therapy going on to hopefully get them back to their normal quality of life.
Right. And that exactly it is education, and people just don't know, right? They want to do the right thing, but we can really guide them. We can answer questions. We have, like Marlon was saying, we have a bunch of therapists through the area. We really cover most of Somerset, most of Mercer County, most of Middlesex can get to us pretty quick. So again, people think Central Jersey doesn't exist. We have good programs in North Jersey, we have good programs in South Jersey, but the hospital's really taken an interest in trying to provide that care to this region.
So is there a typical recovery period for concussion? Is there a typical standard return to be able to play?
Everyone wants to know that. And I always say, look, no one has a brain just like you. So no one's going to have the same recovery time. It's just not feasible. Like Marlo was saying, usually if it's mild and they kind of get in early and we can start some of the active recovery work and we can really educate them on how to get back into things safely so that their brain is healing and developing the correct pathways. You're talking, it could be a few weeks, you know, if it winds up being one of those more moderate or severe concussions. Unfortunately, there's so much more variability in those kinds of concussions. It can be a couple months. It could be up to a year for some people. And there's some people, if they don't ever get the proper care they need, you know, they have lifelong deficits.
So again, the biggest problem is we have no idea how long the concussion itself is going to last. And when the parent says, can I get it back into the game next week? You can't even give them an answer at that point.
I mean, usually, you know, if they're not clearing tests, it's pretty evident, and I can have somebody be pretty symptomatic with certain activities, and I know it's going to trigger them, and I can do it in the clinic in front of the parent. And then the parent and the kid both kind of like understand that, hey, if I can't do this here, there's no way that I can focus on the field. But getting back to your other question about return to sport, there are 2 approved return to learn and return to play protocols that the CDC has really gotten behind, and they're kind of the gold standard. So depending where somebody is, we can put them in there, and it really has very clear steps of what people have to do in order to get back to sport or get back to school. And a lot of the school districts in the area, their 504 is their accommodation plans, and they follow those CDC guidelines pretty closely. Some are a little bit stricter, but none of them are more lenient. So it really just, it makes it objective. It's not it's up to me. It's, you know, hey, this is what the law literally says we can do for your kid getting back to sport in the school setting.
Well, it's good that we actually have those kind of protocols so that it isn't a subjective, but more of an objective return to either sports, playtime, or back to school.
Yes, definitely.
You know, again, years ago, it was basically they'd come back in. You know, I knew a little bit about it, but I couldn't do what you're doing.
And that's exactly the point, is that we know everybody's got a role in this. And a physician who's seeing a patient in their office, we all know how little time that you have available to spend with a patient. You know, you need to screen, see what's going on immediately, and you know, and help with that in the immediacy. We can take the time. So we can do that full hour where we can look at everything, we can discuss with them, really take the time to teach them and the family, and then collaborate with the physician, so that everybody knows what's happening on the healthcare team. And then, we can also involve the school as necessary. The other key to this is to know that, when especially parents or the public, they think about a concussion, you hit your head, you're better in a few weeks, but there's so much more involved. Maybe you do need extra care. Maybe you won't. You might need a neurologist like you spoke of. You might need, vision therapy. There's a lot of different things that may come out of it. And that's why our therapists have all these tools. They can rule in, rule out what needs to be done. And that's why the care in the beginning is so important, so that we know what we're dealing with, and that down the line, if a red flag comes up or something is showing that they need a higher level of care, our therapists can also help refer to that.
Yes. Yeah, exactly. If somebody comes in, for the concussion care program and they have a lot of neurological symptoms that are not appropriate to be treated in our clinic, we're going to refer them to a neurologist. If they have a lot of vision issues, we're going to get them to the correct neurooptometrist to help them address those things, because the only way we can wind up helping the brain heal is through input. And if the pathways to the brain are that involved, we are going to have to get them to the correct specialist. But again, like Marla was saying, it's really a collaborative effort with the doctors that are referring to us. They're only seeing them for a short chunk of time. That's why we use the window of 72 hours. And even if they pass everything in that first time we see them, we're asking them to come back one more time, or at least one more time, for a follow-up in 2 weeks, because that delayed swelling in the brain. So you could see them in the clinic, you could see them in the office, and hey, you look good, you don't have a concussion, and then you don't really notice they don't have any symptoms until they have sustained cognitive loads. So they're in school for a couple hours, a day or two, and then they start having symptoms, or they don't have any issues until they have a cardiovascular load. They went back to sport, everyone thought they were good, 2 days in, they're having splitting headaches, or they're dizzy, or they're falling over. Those are the things that just seeing them in that snippet in the ER, urgent care, or the PCP once can get missed. And that's why we kind of developed a program this way, where we have them at least twice, and we have it far enough apart where we would catch any of those delayed onset of symptoms. And those first 2 weeks are really what's laying the groundwork to making an expedited recovery. If we don't educate them well, and they keep basically re-traumatizing the brain, they're just going to slow down this recovery, and then they can wind up having a lot of difficulty getting back.
Well, it sounds like a terrific program that RWJUH Physical Therapy Department has put together, something that really is very, very important, especially with athletes or even the adolescents. Marla, do you have any key messages you want to leave the audience before we finish?
I mean, just as we've been saying, the key message here is about acting fast and getting the correct education. So we want families to get the care they need and know where to turn to. And that's a lot of times families are left flailing, looking for, who do I call? Where do I go? So that's why we're also, it's not just the physicians that can refer to us. Anyone can call us and say, hey, my son had sustained what might be a concussion last night. Okay, great. We can work on that immediately. So wherever they are in the process. So reach out to us if you have any questions. You can find our sites on rwjbh.org/SomersetPT. And we're willing to talk to anybody. You have questions, we're happy to help.
Thank you very much for being here, and thank you, Jeff, also for everything you do for this program. It's a wonderful program. It's something that's very, very necessary, and something that leadership at both the RWJUH Somerset as well as the Physical Therapy Department put together, which is wonderful for our local community. Thank you both.
Thank you so much.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about the Concussion Care Program at Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/SomersetPT.